I'm a computational scientist. I study women's health. We're using math and tailored algorithms that we designed from the ground up to predict many aspects of women's health. The overarching goal of my lab is to improve outcomes of women globally, around the world. On average, women live longer than men, but they spend around 25% more time in poor health, notably in their most active years, ages 20 to 65. At the Shenhav lab, we're using math and AI to close these gaps. We're developing pioneering diagnostic tools to improve maternal and fetal health. I love studying from a very young age. I was fascinated by discovery or knowledge. I fell in love with math when I realized how useful it is and that I can leverage it for discovery. A core aim of my lab is to develop simple, low-cost tests to identify pregnancy disorders early, before symptoms manifest. Take hypertensive disorders of pregnancy, for example, which includes preeclampsia. It's the second leading cause of maternal death globally, and it's a major contributor to stillbirth and has lifelong implications on women. But there are no reliable early screening tools. Now, interestingly, the root cause of these diseases is in the placenta, but we don't have a good way to image the placenta, to take pictures of the placenta early on in pregnancy. So we're using the eye, and more specifically, the retinal vasculature as a proxy. We image the retina of pregnant women first, second, and third trimester when they come in for their routine ultrasound. Using the first trimester retinal images, we can accurately predict the risk of preeclampsia. And we can do that with an accuracy which is unmatched by any other test. This experimental diagnostic is a major discovery. And the other thing that we're doing in the lab is applying math and AI to unravel the mysteries of human milk. But we know more about what's in a strawberry than what's in human milk. So we need to analyze the composition of human milk in tandem with the early life microbes, those that live in and on our body, that are called the human microbiome. In our paper that has been published in Cell, the pattern that we're finding is that infants that are exclusively breastfed have completely different microbiome development patterns. Together, these projects and others reflect the lab's mission, which is to computationally advance the health of women and children using algorithms, using data-driven insights. The reason that I chose NYU is because my office is right adjacent to the hospital, and I can be part of trials that otherwise will not be possible. I'm having goosebumps even to think about the fact that I can do that for a living. I'm in conversations with OBGYNs around the US all the time, and when I see the light on their face, I can breathe and say, okay, I'm going in the right direction.